Hi guys, welcome back to my channel. It's Steffi. So as promised, today I'm here with Dr. Kotler, my nose surgeon, and he's going to go ahead and talk about everything that he did for my nose surgery. And we're also going to talk about if you're not in town, you're not from LA, how long you would have to stay and all that good stuff that everybody's been asking me about. And he's also offering a free ebook version of his book to all my followers, and I'm going to leave the details below in the description box. So we're going to start.
First, Seppi, it's so great of you to share your experience with people. This is good stuff, and you are so articulate and so friendly and so inviting that I think your viewers have a big treat. Thank you.
No, thank you for doing this with me. I have a lot of questions that people have been asking me, so
We've got
excited
answers.
to answer them.
You got the questions, we have the answers.
Okay, so why
Good.
don't we start with how should somebody prepare themselves for the surgery?
Right. Well, to prepare for surgery, if you're certain as to what you want to have, and of course that's the most important thing, in other words, what don't you like about your nose? And incidentally, as you know, computer imaging is a terrific tool for helping you understand what the result would be. Computer imaging shows on the computer screen, after a paint shop type change, what the outcome would be. And that's very important because when you and the doctor have a meeting of the minds and can agree on what you like, and the doctor, of course, knows what he can deliver, you're going to be happy. So the preview, kind of the future of your nose is visible, and it's great. So that's probably one of the most important things you can do before deciding to have it. Once you decide to have surgery, then it's a matter of time. You do need time to recover. People who even come from out of town generally are here no longer than 10 days. Some people can return as soon as 6 or 7 days. 5 to 6 days is usually what we need to be able to keep tabs on how everything's going, and after that, you're good to go.
I think I was fine after 6 days after they removed everything from my nose. Not that fully recovered, but I didn't really need anything else. So for me, I think a week was perfect.
That's right. That's a good general number. And of course, you're breathing. You had operation not only for the outside appearance, but also for breathing. Those who have only the cosmetic operation just on the outside have an even faster recovery, but just by a day or two.
Perfect. And now let's talk about the surgery itself.
Okay. Well, the surgery itself, first of all, you as a patient don't know what's going on because you're asleep.
You're asleep.
Yeah, you're asleep with an excellent doctor anesthesiologist and a licensed, fully qualified outpatient surgery center. That's the best way. You don't need to be in a hospital. It's very private. There are none of the hassles of being in a hospital. And you generally leave the surgery center an hour after you've had the procedure. Now, people who are local, of course, go home. People from out of town can stay with friends or relatives or even one of the nice little boutique local hotels. Time in the surgery center, depending on whether one is having the breathing operation in addition to the cosmetic surgery, usually 4 to 5 hours. There's preparation time ahead. And by the way, some people are concerned that they're going to be nervous on the day of the surgery, and that's understandable. The answer to that is a little pill called Valium. Valium, the tranquilizer.
I had to take one.
You have to take it because once you get to the surgery center, as soon as you check in, the nurses give you the little Valium pill under your tongue. In about 10 or 15 minutes, you're kind of like, oh, this is just fine. And I remember you because
I was very scared. I was like, I don't know if I want to do this. And then I took the pill and I was like, let's do this.
See, that's the idea. Because, look, you had nothing else to do that day. So you could be very sedated. The anesthesiologists are very, very happy to have our patients have that pill because their blood pressure goes down, pulse rate goes down. It's an excellent way to begin the anesthetic. And the anesthetic is very simple. Once they find the best vein in your arm or hand, they put in a little intravenous line and all the medicines are given, including the great colonoscopy drug propofol. That's the great anesthetic. They give it to you. You go out. Next thing you know, you wake up. And there's no pain even when you wake up. Why? Because during the surgery, and you wouldn't know this, the first thing we do is inject local anesthesia just as a dentist would. And therefore the area are frozen, there's no pain about the whole entire front of the face where the nose is. So when you wake up from surgery, you won't be in pain. And if there's some discomfort later on, which is possible, we've already provided pain medication for you, and you take that as needed at home. Honestly, I had my nose done I had very little pain. I was waiting for the big pain to show up, and it didn't. So I
Same
never
here.
took a pain pill. But
Same
some
here.
people, yeah, right. But some
Yeah.
people need it because everyone has a different tolerance for pain.
Yeah, I have a very high tolerance for pain. So for me, there was no pain. There was just a little bit of discomfort, but that was about it. Like no, I didn't have much pain at all.
That's typical. But whatever the patient's experience is, we have the ability to make it not burdensome. We have pain medications, we have tranquilizers, we have sleeping pills for those who may have trouble sleeping. It's all manageable.
And plus, you have his phone number to bug him whenever you're in pain, so you can just give him a call. Hi, Dr. Kotler.
Hi there. Well, that's true. I believe that to best serve my patients, I have to be available 24/7. So all our patients receive my home phone number and my cell phone number, so they can call me anytime with any questions. And I will call each one of our patients that evening, the evening of surgery. I'm going to call at home around 8, 9 o'clock. I want to hear how things are going. I want to make sure the patient's comfortable. Make sure by that time you should have had something for dinner. And by the way, whatever your stomach says you want, you can have. There are no restrictions. And there's almost no nausea and vomiting now because of the great anesthetic drugs that we have. So generally by evening time, things are going well, and if there's any questions, I want to be able to answer them. And the next day, we speak with our patients again. And by the way, if they're having just cosmetic surgery, an office visit the day after surgery is the perfect time to be checked, and we take out the little world-famous Kotler nasal airway, the little breathing tube, my invention I'm very proud of, so people can be comfortable from the minute they wake up. And we take out a little tampon, and so after one day, the only thing left on the nose is a little plastic protector for another 3-4 days. So it's pretty straightforward.
It was pretty simple for me. I just waited because I think I had both the
You had
cosmetic
both, right,
and
right.
actually fixing the broken nose. So I had to wait 5 days, and then
That's
they
right.
removed everything from it. And really, the only, I think I would say, painful part about the whole procedure was taking the little tampon. That was it. And that wasn't even that painful. So it was, the whole surgery was just not painful at all, in my opinion. But everyone's different. I had a great experience with him, so I'm happy.
Thank you. I've been a patient, as I say, I had my nose done. It really was a lot less of a burden than I thought. And by the way, even when we take the packing out of the nose, a little tampon in the air tube, we put liquid anesthetic, and it really makes it quite bearable, and only takes really just but a few seconds to take those things out, and it's done. So modern medicine with good anesthetics, good drugs,
Good doctor.
makes it, that helps. I agree.
Good doctor.
But we want to be a good doctor. We want to be attentive. We want to bring to the patient the best that is available.
And thank you for that, because I had a really, really good experience. People who saw me a week after surgery, I went back to work, and people were like, "Did you get your nose fixed?" I'm like, "Yeah, I did." Because it looked so natural. It didn't even look like I had changed that much. So I was very happy about that. More than anything was the fact that I didn't look like I just got my nose done.
Well, that's what we like to hear, and the truth is, every patient wants to have a natural nose. No one wants to look as though they're carrying a sign that says, "Look at me, I had a nose job."
Like
You may or may not. That's right. Overdone is not too good. If the tip's up too much, too pinched, too slow, no one wants that. People want a natural nose. The best compliment we get is, "Gee, even my sister said, God, I think you look great. I wouldn't have known you ever had a different nose." So that's important. Natural noses are the key.
One of the things that I get asked a lot when people ask me, "Oh, did you get your nose done?" and I say yes, they always look around my nose for, like, the cut that people make around the nose or underneath, and I haven't been able to find it. So I'm guessing you didn't cut around my nose.
The incisions are all inside, using the technique that we use in our practice. Now, other surgeons, and very capable and competent and good surgeons, may also choose to, besides the inside incisions, make incisions on the outside. My preference, whenever possible, is to avoid the external incision. Therefore, all incisions are made on the inside, and all the stitches dissolve, and that's nice.
Yeah, I get that asked a lot, and I'm like, I don't know, either like he was very good and you cannot see it, or he's very good, but I think it was done internally, and that was one of the most asked questions. I also got asked a lot about, can you play sports? How long should you wait to play sports after your surgery?
These are all great questions. At 10 days, you can do any athletic activity you want. The reason why we wait 10 days is it takes 10 days for nature to seal off the little blood vessels, so there's little chance of a nosebleed. That's the main thing. And by then, the swelling is down considerably, and the black and blue is usually gone if there is some. And so 10 days is a good time. The only exception to that would be if you're going to go out and play field hockey or soccer. Be careful with your nose, because it's going to be another 5 to 6 weeks before the nose is rock solid. The nasal bones have to weld together. But apart from contact sports, there are no restrictions. I went swimming 8 days after my rhinoplasty.
Oh wait, you weren't supposed to say that because I told people I don't want to go to the beach because I got my nose
Oh,
done.
sorry, I blew it.
Yes, because I hate the beach, so I've been avoiding it. I'm like, I got my nose done, I can't go in there.
Well, remember, you can say anything you want.
Alright, so what about, we talked about after surgery as well, we did?
Yeah, and recovery. Most people find the recovery to be less of a burden than they think. I think we all tend to magnify our concerns and fears. I think the best way to really understand what it's like is to listen to CEPI and listen to other people who have had the experience. And that's why websites are so important, because a good website, and we're proud of ours, it has a lot of patient commentaries. It has videos. It has their written reports of what it was like. This is huge. We didn't have that years ago. It was very hard for people to understand the experience. Today, we have 130 videos on our website, and we have hundreds of reviews and testimonials which tell the tale, tell the story of what it's like to be a patient. I think that's very valuable, because when you hear from CEPI and other people that, God, this wasn't terrible, it wasn't a torture session, you're going to be more comfortable. And it is elective, though. It's something that you have to decide you want. It's not as if your appendix is about to burst and you have to have it taken care of. So it takes some time to be comfortable with the decision, and that's okay. And the more homework you do, the better. Because I think the more homework you do, you'll be less fearful, you'll be more comfortable, you'll be more confident, and then that's the time to do it.
Yeah, it took me personally about 8 years to come to terms with the fact that I really need to get mine fixed, and I was looking for a good surgeon for a long time, and then I came across Dr. Kotler, and what really helped me was actually going on his YouTube channel and watching the videos he posted. So he has, I'm going to actually mention that on my video as well, link it. He has a really good YouTube channel that has, like, literally from day 1 after surgery, and then day, like, 3 days after surgery, 5 days after surgery of patients and how they talk about the procedure. You're going to see how everybody looks different because everyone's different, but he gave me a lot of confidence that I'm going to a really good surgeon, because even though everybody was different, they all had one thing in common, and they were really happy about the outcome, even 2-3 days after surgery. And I was just, made me very confident, and it made me realize, you know, I want to go with Dr. Kotler rather than a lot of different doctors. That's what I liked.
Thank you. Well, we appreciate that. We think, again, it's a matter of patient education. That's why we're very appreciative when our patients like CEPI are willing to share their experience. We call it the journey. Well, what was the journey like? How was the first day? How was the third day? How was the 5th day, the 8th day? And we have all those. And on our website, the section is called The Journey, with that. So that plus the videos, because the journey shows the photos. So you will see that you're not going to look like you were hit by a truck, 1 day or 5 days after surgery. And the truth is, most people that have cosmetic nasal surgery with or without the breathing are younger people. And younger people heal well. Younger people aren't on a lot of medications. And when you heal quickly, the experience again is better. It's not weeks or months. It's all about days.
So if you guys have any other questions, you can always contact Dr. Kotler's office, but you can also go on his website, YouTube channel. You can always, he also has an Instagram account that you can check out and ask him questions.
Yeah.
If you have any questions from me, you can always contact me. You know, my Instagram, Makeup by CEPI, YouTube channel, Makeup by CEPI. All of those are Makeup by CEPI. So you can always ask me questions, and I hope, we both hope this was useful information for you guys, and we hope we have helped you to make the decision whether you want to get your nose fixed or not. And thank you for asking us to do this. And thank you, Dr. Kotler, for doing this with me and answering all my questions and my friends' questions.
It's always fun with you, Seppi, and how good of you to do this for all your followers and viewers. I think that's very generous of you.
Thank you, guys, and thank you, Dr. Kotler, again. We will see you soon. Bye.
See ya.